Now we will discuss highlights on the microbiology of Haemophilus ducreyi. Haemophilus ducreyi are fastidious, pleomorphic, gram-negative coccobacilli. As you can see here, they are pleomorphic, have several shapes, and they are coccobacilli. They are fastidious, which means they require specific nutrients to grow. That's why they grow on enriched media like chocolate agar, and usually after addition of vancomycin to restrict the growth of gram-positive bacteria. They are oxidase positive and catalase negative. Haemophilus ducreyi cause a disease called chancroid. It's a genital ulcer disease associated with tender lymphadenopathy in the groin area, and it's rarely invasive, so it usually does not present with fever, so there is no fever in these cases. Haemophilus ducreyi causes intense inflammatory response with accumulation of neutrophils and macrophages, so it's purulent. And when it causes an ulcer, it shows necrosis in the bed of the ulcer. Haemophilus ducreyi produce cytotoxin that kills the infected epithelial cells, and this is the cause of the pus formation and the necrotic tissue formation. This leads to the development of characteristic chancroid ulcer. And here it's ulcers, not a single ulcer, so it's multiple. Might be solitary, of course, but it's also multiple. So because we have a cytotoxin that's causing death of cells, the ulcer would be of ragged edge and undermined edges. Haemophilus ducreyi are virulent because they prevent phagocytosis through their secretory proteins, and the outer membranes express proteins that protect them from the complement proteins. So they resist phagocytosis and they resist the complement proteins' lytic activity. A chancroid is typically painful ulcer. It's either penile or on the buttocks, and it also affects females, but in many females it's asymptomatic. So it might be an ulcer on the labia minora, for example. The organism is isolated from material from the ulcers or in pus from lymph node aspirates. So when you try to isolate the organism, take your scrapes from the base of the ulcer, from this necrotic material, or aspirate the lymph node to obtain the organism. There is a correlation between HIV transmission and chancroid lesions. So many reports clarify that lesions of chancroid have facilitated the transmission of HIV, and severity of chancroid might be worse in patients who are HIV positive, and this is related to low CD4 count. For the diagnosis, culture is a gold standard, and as we have mentioned earlier, chocolate agar is preferable. PCR is important for diagnosis, or is feasible, and as sexually transmitted diseases need a differential diagnosis, and then sometimes there are combined sexually transmitted disease infection. What's available now is what's called a multiplex PCR, which tests simultaneously for Haemophilus ducreyi, Treponema pallidum, and herpes simplex type 1 and 2. Just bear in mind that herpes simplex causes painful genital ulcer. Haemophilus ducreyi cause painful genital ulcer, but Treponema pallidum cause a painless ulcer. Serological tests are usually of limited feasibility. They even can't differentiate old and recent infections. Now we come to antimicrobial agents. Which antibiotic to use? Most Haemophilus ducreyi are beta-lactamase producers, and in the same time resistant to tetracycline and cotrimoxazole. That's why the preferable treatment is through macrolides, through cephalosporin, and quinolones. So it's either azithromycin, which is a macrolide, this is single dose treatment, ceftriaxone, cephalosporin, again single dose injection, or ciprofloxacin or erythromycin, quinolone and macrolide again, but they need more prolonged therapy. Especially for patients who are HIV positive. In HIV positive individuals, don't go for the single dose regimen with azithromycin or ceftriaxone. Just go for 3 days of erythromycin or 7 days of ciprofloxacin. Prevention of such chancroid is through monogamous relationships, use of condoms, which are very effective, and along with identification of partners and treatment, because as we have mentioned, female patients might be asymptomatic at all.